Hi there, I'm Miriam Evans, pelvic health physiotherapist in Powys. This is just an advice video for you if you're having gynecological surgery. You might be watching this before you go for surgery and then you'll be knowing exactly what to do day one, or you might be a few weeks post, it doesn't matter. Now, gynae surgery, you could be having major surgery into your abdominals with a cut across your lower abdominals or up the centre. You might be having a vaginal surgery, or you might be having laparoscopic surgery, and therefore recovery will really depend on what surgery you're having, but also your age and your previous levels of fitness. So wherever you're at, try and don't take my video word for word. Think about where you're at and how your recovery could look. So just quickly about day one. If you haven't had your surgery yet, or you've just had it, try and get moving as soon as you can. First of all, lying in bed in a hospital can cause chest infections, so we want to get you moving, get you breathing nice and deeply, and get your feet moving for circulation reasons. So every hour, take 3 or 4 deep breaths right into your ribs, so you're getting the... So you could take breath in for 2, out for 3 or 4 times every hour, and then wiggling your ankles as quick as you can for 30 seconds every hour, and that'll just get the circulation going, and ideally getting out of bed if you can. So the first time you get out of bed, you might feel a bit lightheaded, you might be feeling too sick to get out of bed, but if you're able to, do it with somebody else, don't try and do it on your own, and get out slowly, and just try transferring to your chair where you're comfortable. The more upright you are, the better it is for your breathing. If you're able to, there's no reason why you can't go for a little walk. See if you can walk a short distance to the toilet and back, but again, don't try it on your own. Make sure that someone is with you, just to make sure that you're safe. When you've had surgery, there can be scar tissue that forms, and that will form if everything sticks together. So if you're not moving, the skin might stick to the muscle, might stick to the pelvic organs underneath. So another reason for moving is to stop any scar tissue forming. So that could be just walking around so that your body's moving, your skin is moving over the muscle, over the organs. Or it might just be that you can do, if you can't get out of bed, there's no reason why you can't do some massage around the area, not on the scar, but away from the area is also quite a good way of releasing, making sure you don't get too much scar tissue forming. Moving over the next 6 weeks as well is going to help reduce scar tissue, and as that wound starts to heal, if you've got a wound on the front, or if you've had a tear or a cut into the vagina, and the stitches start to heal after about 6 weeks or so, you can start doing some massage of your scar area, desensitizing it with light touch if it's very sensitive, or it might be that you can go a little bit deeper if it feels really lumpy, or there's certain parts of the scar that might feel lumpier than others. You can do a bit deeper massage, but making sure it's fully healed, it's not bleeding, there's no signs of infection, and then you should be okay to do that. On day one as well, and the following days afterwards, you might find you need to cough. It's quite common if you've been under anaesthetic to need to cough and clear your chest. That could hurt you, so if you get a pillow, put your pillow over your tummy, hold it tight, and then cough into the pillow. And even better than coughing is if you can try and huff. Reaction is to cough, but actually a huff is just a bit less pressure straight downwards, it's a bit more spread out. You can do long huffs to get the phlegm up off the chest, and then when it's up here ready to come out, short huffs are a little bit better, but they're just less pressure than a cough. If you are coughing and you're standing up, just try tucking your bottom under, clenching your bottom, and then doing a huff or a cough using your bottom clenched. It will stop you pulling your tummy in, and if you pull your tummy in to cough, you just kind of bear down. I'd even think about if you are a smoker and you're smoking regularly, you may not have a smoker's cough now, but it's very likely if you continue that you will develop a cough in the future. And I see a lot of women with chronic coughs because they've been smokers or they are still smokers, and then displaying symptoms of bladder incontinence, urine incontinence, or prolapse because of all the coughing and the pressure downwards. So if you're able to try and think about stopping smoking, you could contact your local smoking cessation team through your local authority. There are lots that you can literally just text them, help me quit, send a text, and they will get in contact with you. So it's not difficult to do it, and they will give you all the support you need to get through that. So another thing after surgery is opening your bowels. You don't want to be straining. So also avoiding vomiting. So I know that if you've got a suspicion you might be allergic to certain pain relief, particularly morphine, some people get a reaction to, just make sure that the nurses know and don't give you something that's going to make you vomit, because again, the downward pressure can be a bit much on recent surgery. So opening your bowels, you might find it helpful to use some tissue on your hands and to push your fingers against your perineum, against the vagina part, so that you're not putting too much pressure on that, to make it a little less painful, but making sure you're not constipated. So drinking plenty of fluids, eating your fruits and vegetables before you have surgery, and continuing afterwards. Good fibre diet, so mixing your soluble fibres, insoluble fibres. You can find plenty on diets for reducing constipation online, but making sure that you are drinking enough that you're getting a nice soft stool and you're not having to strain. In terms of positioning for emptying your bowels, try and sit leaning forward on the toilet. So if you can find a little stool about so deep, put it on the floor in front of you, get your feet on that stool. So one of those kiddie stools that they use to wash their hands is perfect. Put your feet on that and then lean your elbows on your knees as you're leaning forward on the toilet. And if you're holding your breath while you're doing a poo, you will be straining. So you need to keep breathing in and out, nice and gently. Keep breathing. The moment you stop breathing, you're probably straining, and straining is creating downward pressure. You will need to do a slight push to start the stools moving, and then just relax and let them do what they do. The leaning forward position helps to set the bowels up for the stools to come straight down, rather than having to go through the S shape of the anus when it's tight, when it's not expected, when you're not needing to go to the toilet. So relaxation is really, really important. You might find also, if you drink a lot of caffeine, that can dehydrate you, because it's a diuretic, and that can make your stools solid as well, which makes it a bit harder to go. So just think about reducing the caffeine for a while. So coming on to pelvic floor exercises, and abdominal exercises, so and your glutes as well, so your core muscles, your abdominals, your glutes, your pelvic floor, they all work together. So just doing pelvic floor won't necessarily get you strong here, and just because you haven't had surgery into your pelvic floor, you've had it here, it doesn't mean that your pelvic floor is absolutely fine. You might find that by having abdominal surgery, it switches off your pelvic floor. So if you're able to do pelvic floor exercises, whether you've had surgery into the vagina or not, and your core exercises, do both of them regularly. You could do pelvic floor exercises 4 or 5 times a day. And the ideal way to do it, so that you remember, is to have a routine that works for you. So, for example, it might be that every time you're having a hot drink and you're boiling the kettle, you do pelvic floor exercises, watching adverts on telly. It might be that every time you've been for a wee, that you stay on the toilet, put the toilet seat down, sit on the toilet, and do your pelvic floor exercises in the peace and quiet of the toilet before being harassed by everyone else in your family when you leave the toilet. Finding a routine for you. Some people find it useful to put stickers around their house, and whenever they see a sticker, they do the pelvic floor exercises. For doing pelvic floor exercises correctly, please watch my pelvic floor exercises video. So if you subscribe to this channel, you'll be able to scroll through all my videos and find the pelvic floor exercises one. Then the core exercises video, there's also a video for that. So have a look at those. You can start doing core exercises straight away, day 1 post-surgery. The main thing is to get this lower abdominals working. We don't want to be overusing your upper abdominals, because what will happen is that you just bear down. Once these have been weakened and switched off, with an operation, it might be that you've had a cesarean in the past, or you've just had that hysterectomy or abdominal surgery, and that muscle switches off because of surgery. This one tends to compensate, and we adopt this posture of sucking in, where your belly button lifts upwards and pressure goes downwards. If you're having surgery because of prolapse, or you've got any symptoms of prolapse, most prolapses are not caused just because of weak pelvic floor. Most prolapses are caused by the way we've used our tummy all our life. So if you always suck in your tummy, you're stressed and you pull in here, or you're lifting and you suck your tummy in, that pressure has to go downwards, and it goes down onto your uterus. fact, I'm just going to show you a demonstration with my squeezy chicken. So if I squeeze the chicken in the upper abdominals, it lays an egg. Now, it's a bit of a funny way of showing you, but that's exactly what's happening. If you're pulling in your tummy all the time, as you're squeezing your tummy, you're bearing down, and it starts to come out at some point. So just because you've had a hysterectomy, it doesn't mean you can't get a prolapse in the future. If you've had a hysterectomy, the walls of your vagina, those 10 centimetres average, are left, and they've now got nothing to hold them up. So over the next 6 weeks, they've got to knit the tissues around them. If you're lifting, coughing, pushing, pulling over the next 6 weeks, those walls can come down, but you're also going to have to be careful for the rest of your life with lifting. So try and avoid heavy lifting for the rest of your life. Try and avoid exercise that is high impact for the rest of your life. You should never need to do sit-ups, even hundreds, stomach crunches. They're all causing pressure down below. Double leg lifts, if you do Pilates, never again. It's a real cause of prolapse because of the pressure. If you haven't got the strength of these muscles, you will compensate with these muscles, and these muscles will push downwards. So you have a look at my core exercises video for strengthening those. If you love Pilates, I love Pilates. They are great if done properly. I see a lot of people that cause themselves prolapses because of Pilates, but I also see a lot of people that are better from prolapses because they've been doing Pilates. And it's key that you get these muscles functioning when you're doing your Pilates. It's also key that you breathe through your exercises. If you're holding your breath, you're probably using this muscle to do your exercises too much. So try and do Pilates with an instructor who comes and checks how you're doing it, and always go for a beginner's class. You don't need to progress with Pilates too much. Just doing the basic exercises every day is going to really support your pelvis and help you function and recover properly. So an easy thing, if you think, well, I haven't got time to do exercises, I haven't got time to do my pelvic floor exercises, even thinking about posture can help you a lot. If you can get into the right posture, you will be using your correct muscles. They won't be as strong as if you do your core exercises once or twice a day, but at least you're thinking about posture. So when you're standing, what are we trying to think about? Tucking tailbone under. If you see my belly button, my pubic bone and my hip bones, they are completely flat in this posture. If they're not flat and they are leaning in sort of this position, or they're leaning in that position, then I'm compensating with other muscles. So just trying to find a neutral pelvis, okay, so that your tailbone is a little bit tucked under, your pubic bone is just up, so that you're feeling like they're nice and equal. That will be you'll feel a little bit of your glutes working in your bum, you'll feel a little bit of your lower abdominals working. And then, and avoiding one leg standing as well, standing equally. Then when you go to lift things, in that posture, so you go to lift your kettle or your cup, or you go to open doors, whatever you're lifting, you'll be using the right muscles. Try and avoid such heavy lifting, and when you're leaning over and bending, again, try and tuck your tailbone under so you're supporting your pelvis, and then bend your knees as you pick things up. Try not to overfill your kettle, so in terms of releasing weight. Think about heavy pots and pans that you're lifting. Can you use a Henry Hoover that drags along the floor rather than an upright Hoover that's quite heavy? So over the next sort of 6 weeks, you need to think about what you're doing. That obviously depends on your surgery. If you had prolapse repair, or you've had an abdominal hysterectomy or vaginal hysterectomy, those sort of things where you've had major surgery, you might not feel like when you look at yourself you've had much. Your scar might heal very quickly. You might have nothing to show for it, but you've got a lot of healing that needs to go on internally, and you've got to remember that. Your body needs to rest and recover. You also need to avoid heavy lifting, because the chances are if you've got weak muscles here, you will overuse this muscle, you will bear down and cause damage to the surgery that's been done. So avoid the heavy lifting. When you do need to lift, engage the right posture to lift. So just be aware of that. And then in terms of getting back into exercise, returning to exercise, think about what you did before. So if you were quite fit and healthy before, you might be able to get back to that a lot quicker. If you never did any exercise before and now you're thinking, I need to get fit, start off slowly. Start with walks. And even with walks, for the first few weeks that you go walking, you might want to do just a few minutes, build it up to the next a little bit longer. Then you might do 10 minutes. You might even just do 10 minutes in the morning, midday, and in the evening. If you do like all of that together and you do a 40-minute walk, you'll be exhausted and you'll be like, oh, why did I do that? And you've set you back for a couple of days. So little and often is really important. Think about how much you can do sitting down. So if you're cutting your vegetables, can you chop them sitting down? If you're washing up, can you get a stool behind you so you can sit down doing that? So think about how much other people can do for you, how much you can rest. Going back to things slowly, don't get demotivated too much. If you get to 6 weeks and you're still exhausted, it's normal. Recovery could be 3 months plus, depending on the level of surgery you've had. Driving is going to depend on your insurance company, so check with them before you drive. A lot of them say 6 weeks post major surgery, so again, check with your consultant of what they think there. The idea of that is that you can do an emergency stop, that you're not getting pain as you lift your leg to do an emergency stop. So just practice in your car on the driveway before you decide to drive, and then contact your insurance company. And then the last thing is, sorry, my dog's taking a drink. The last thing is, not the last thing, HRT. If you've had surgery and you've had your uterus removed, you'll probably need HRT. So just if you've not had it, just watch out for mood changes, vaginal dryness, and pain on sex. Just think about those things. And in terms of sex, you probably want to wait for 6 weeks if you've had major, again, depending on the surgery, for stitches to heal, so that you're not causing any bearing down effect on the surgery. And again, just make sure the first time you resume sex that you use plenty of lubrication, so that you're not causing pain. And you might want to do some perineal massage yourself before you have sex. So just have a mirror, look down below, check everything's okay yourself so you feel happy. You can have a look, if you've got a scar there, you could have a feel of the scar and just make sure that's not too painful. Do a bit of vaginal perineal massage. Again, there's lots online for that. And then just being as relaxed as you can, knowing that you're unlikely to cause any problems, any damage. So if you've got any problems, having watched this video, you're more than welcome to contact me or contact your local physiotherapist. And I hope that some of this is useful to you. All right, bye-bye.